Are you suffering from tennis elbow? Hi, I'm Andrea DeLange, physical therapist and owner of Accelerated Movement Physical Therapy. It's Movement Monday, and with spring upon us, this Movement Monday video is gonna tackle the most common injury in tennis, known as tennis elbow or lateral epicondylitis. So, what is that? Well, that's inflammation of the tendons of the forearm that attach to the outside of your elbow. And it's typically due to overuse of flicking your wrist. And there are three things that you should consider. First thing is your technique when you're playing tennis. Second thing is your equipment. Do you have the right size racket? Your grip strength. How's the tension of the strings? And the third thing, which I think is most important, is do you actually have tennis elbow? So tennis elbow should feel like this. It is a very specific localized pain on the outside of your elbow. Might even be tender to touch. You generally feel the pain when you're gripping, like opening a jar or holding your coffee mug, or any type of wrist flicking exercise. You might feel some symptoms. So if you're experiencing other things such as pain that radiates up your arm from your shoulder or down into your wrist, and you have pain at rest, those are not typically symptoms of tennis elbow, and you should seek out your healthcare professional and make sure you have a thorough exam to make sure you're doing the right thing for the right injury. So if you do think you truly have tennis elbow, I want to give you two exercises that you can do that can be either rehabilitative or preventative. The first one is just by using a tennis ball, just gripping a tennis ball, holding for 3 seconds, multiple repetitions, multiple times throughout the day. That's going to strengthen those muscles there. The second exercise is called an eccentric wrist extension exercise. Eccentric strengthening is great because it generates more force throughout the muscle to help rehabilitate the strength in that muscle sooner. So you want to rest your forearm on a surface, okay? And you're going to use the arm that doesn't hurt to help lift your wrist into that fully extended wrist extension position, and then the wrist is going to lower by itself. So you're going to lift your wrist up, and then it's going to lower by yourself. And the other thing that this helps with is a lot of times it's the up motion that creates the pain, and so you're still able to rehabilitate that muscle without doing the actual movement that results in the pain in the first place. So, make sure you have tennis elbow. Try some of these tips. Thanks for watching.